So PAD stands for Peripheral Arterial Disease. What that means is that patients with high blood pressure, high cholesterol, diabetes, smokers, a lot of just genetics, but they can get narrowing and blockages in their arteries in the legs. Similar to what patients have heard about in their heart, where they get the blockages in the coronary arteries, the same thing happens down the legs. And so patients, typically the earliest symptoms will be what we call claudication. What that means, as you walk and move, your legs start to get tired. They could start to burn or cramp. The next step could be what we call rest pain, to where patients get burning and stinging and constant pain and throbbing in their feet, just even when they're sitting. Typically, that progresses with time over to patients that can have active wounds, and you get ulcers. A lot of patients that are diabetic are familiar with that. A lot of times with diabetes, it's complicated because you can also get neuropathy. Neuropathy is where you get disease of the small nerves to where you don't have a lot of feeling in the feet. And so those patients, it's a bad combination. They can't feel their feet very well. They don't have good blood supply in the feet. So then they get a shoe that rubs them the wrong way. They step on a tack. They do something. They stub their toe. They don't realize it, and they get a wound. Because they have diabetes, they have poor wound healing. That's confounded by the fact they don't have good blood supply getting to the wound to heal it. And that's where patients end up with infection and ultimately amputation. So the goal of our specialty when we're treating patients with peripheral arterial disease is to improve the blood supply going down to the legs, to help with patient symptoms such as claudication and rest pain, but also help them to heal wounds that they currently have and prevent them from getting new ones.